minutes, and then we can start. So 2 minutes, and then we start. Maybe in the next 1 minute, if you have a friend, you have someone that you would like to remind, we could use that 1 minute to remind those who we think might also be interested in joining our Lunch and Learn. Yeah, as Joan said, this Lunch and Learn is always on the last Thursday of the month, and as the name suggests, lunch and learn. So we use our lunch time to learn something, and Majesty Training Associates, as a way of giving back to its clients, offers this session every month, every last Thursday of the month, to share something. There are different topics that have been shared. So this month in particular is something to do with cancer, breast cancer, cervical cancer, and any other cancer. So I welcome everyone who has managed to join in. Thank you for sparing your lunch time, just the 30 minutes that we have to listen. You listen and learn, so that we are aware these days cancer is becoming so, at least every person knows someone with a cancer. So we need to learn something. So we are grateful that Dr. Bossa Brian accepted to come and join us so that he can share with us something to do with cancer. Good afternoon, everyone. My name is Francis Musinguzi. I work with Majesty Training Associates. For those who don't know Majesty Training Associates, Majesty Training Associates is a company that is meant to offer and give you support in personal development, business development, and organization development services so that you thrive. So if you have anything in the personal, business, or organization that you want to, you can always contact Majesty Training Associates, and we do this by speaking, like a doctor is going to speak, mentorship, coaching, hand-holding services. So that's what Magista does. So as one of a way of giving back to the clients, we offer this lunch and learn once a month, the last Thursday of the month, to talk about areas of personal development, business development, or organizational development. And this month, it's more of personal development because we're talking about cancer, and we need to learn something about cancer. So I don't want to waste a lot of time. I would want to invite Dr. Brian Bossa. Doctor, I want you to introduce yourself more, and then immediately you can roll in and tell us what you've prepared for us. For those who have questions, please, you can put them in the chat. Doctor will answer these questions at the end of his presentation. So Dr. Brian Bossa, you're most welcome to this Lunch and Learn. Please feel free to start. Thank you.
Thanks, Francis. Thanks, Magistrate Training Associates, for hosting me. Thanks, Joanne, too. My name is, as it states there, Dr. Bossa Brian. I am a surgeon at St. Francis Hospital, Zambia. I do laparoscopic surgeries, I do endoscopies, I do general surgeries, I do breast surgeries. So that is my nature of work. That is my docket. I am going to present to you breast cancer and a bit of cervical cancer. I'll use like 12 to 14 minutes so that we can have a good discussion. First and foremost, before I roll in, breast is not only for women. Men have breast too, but they're a bit rudimentary. But then they also suffer from breast cancer. So if you are a man over there, you are not an exception, though it's more common in women. And vis-a-vis cervical cancer, that is only in women because it's only women that have the cervix, unless otherwise. But only women have the cervix, and that goes for them. We'll start with breast cancer. We'll discuss the magnitude of breast cancer, how it affects us, because according to what the Majestic Training Associates are about, team building, then supporting people, you have to support normal people. You have to support people that have dealt with their social responsibilities. And if you have a relative that is undergoing breast cancer, you have to take care of them, and probably you have to screen yourself too, so that you can become productive in the years to come. That is where screening comes in. We shall dwell so much on screening of both and possibly discuss a bit about treatment so that we are on the same page. To start off, just how does breast cancer affect us? Globally, there is around 670,000 deaths, and that was documented in 2022. And roughly half of all breast cancers occur with women, and they usually don't have any specific risk factors apart from sex age, though we shall see some of those risk factors that one can have. Then, of course, breast cancer is most common in women. Yes, but as I told you that men also suffer from the same, though it's about the percentage is about 0.5 to 1%. So we definitely know what might give me risk for breast cancer. So there are things that you can't control that we naturally have to accept, and there are things that we can't control. So the things that you can't control, you may find that in your lineage there is a family history of breast cancer. So for us Africans, we are not very privileged of looking at our generations. But this is things that we are going to start looking at our generations. The first generation, what do they suffer from? Second, third, and if it's coming out from you, then you probably have to document it for your children. Yes, so that we do not hide. We have a feeling of hiding diseases, but nowadays people need to know so that they prepare. Even if you have a sick mother, mother that has been diagnosed with breast cancer, then just know that you have a risk of breast cancer. In that, if you have a father that has been diagnosed with breast cancer, then just know you have a risk of that. Then there are genetic mutations, yes, that we usually check for. Take an example, if cancer presents at an early stage. You know, in the olden days, people used to think that cancer is only for the old people. It's partially true, but we see lots of cancers in the young population now. Yes, you can see a lady of 26 years and they're battling with breast cancer. So it's possible. So for people who work in radiations, you're also exposed to that. Then the menstrual cycle, we note that most people who do not give birth have a lot of exposure to hormones. So they menstruate every month, in, out, and they do not have a break in that. We have noted that they are at risk of breast cancer than person who will give birth and rest through those hormones a bit. Then for people that have big breasts, that's what we call dense breast tissue. It makes the diagnosis a bit difficult, and we diagnose it late. So for the things that we can control, we would advise you is to try and do exercises. When you do some exercises, there's a hormonal balance that you give. You please cut on your weight because fat cells produce lots of estrogen. Then the alcohol consumption. So we'll ask that you people decrease on alcohol consumption because there is a relationship between alcohol and most cancers. Then people that use hormone replacement therapies, people that have hit early menopause, you'd find that they are predisposed to cancer. Then we would urge you people to breastfeed. When you breastfeed, there's a way it reduces all the risk of breast cancer. So generally, that is simply breast cancer risks. Now, your presentation, what made someone present with? Generally, so someone might come in with a nipple discharge, some might come in with a lump, someone might come in with just a skin change on the breast, armpit pain, change on how the nipple looks. It might be inverted. So one might have a very big lump. Lump is a swelling. So others may have dimples. Then others may be pulled up nipples, skin irritation, skin dimpling. So these are some of the signs. And I didn't say that whenever you have them, you have breast cancer. Let's let this go on note. But then when you have them, please come to the doctor, come to us so that we check and just prove that you are fine. So that is part of screening. So there's something I wanted to talk about when I display this. I hope these images won't do you bad because you're not medical personnel. I'm sorry for that. But when you have a cancer, it goes, what you people say, it moves to other organs. It moves to other things. So breast will go to bone, lungs, liver, and you'll find that we'll have late presentations. Most of our societies here, people come in late presentations of breast cancer. Breast cancer has stages. It has stage 1, stage 2, stage 3, stage 4. But most of our individuals that we get here present in stage 3 and stage 4. So this is the focus of my presentation, to try and do some checkups so that we can get this early. Because when you get this early, the survival rate is longer. You know, when we are talking about cancer for us, we talk about the survival rate. So because they may be recurrences, they may be cures, but the survival rate when you have stage 1, it's not like when you have stage 4. Because we have a saying that everyone who's diagnosed with cancer, they are dead. No, that they are not dead. It depends. We really can do something for this. For the breast cancer screening. So when you see any of those symptoms that you have mentioned, usually I'm going to take you through a breast self-exam. So usually when you do a breast self-exam, you can actually get to see whether there is a lump, whether I have a lymph node in my swelling. Then after you come to hospital and we do a series of that. So we do a series of that. We do a mammograph, we do an ultrasound, depending on what we tell you. We can even do a magnetic resonance imaging. And those are all things that we do. So in a breast exam, self-breast exam, I hope you all can have a look at this. So you see, usually human beings have two breasts, and that is it. So you can raise your hand or lower your hand or flex, and all these maneuvers help if there is a swelling for it to come out. That is what I can say. So if you're examining the right breast, then you're going to use the left hand. If you're examining the left breast, then you're using the right hand. And you use these fingertips for feeling. And you do it all through this movement. Okay? And some may use a vertical pattern, some may be a clockwise pattern, but make sure that you examine the whole breast. You get into an idea of examining the breast, but it's better when you come and we teach you what a normal breast feels like. Most of us have breasts, and we actually don't know how a normal breast feels like. Because you may touch a normal breast and you think it's abnormal. But for ladies particularly, they really feel something if it's there. And it's better when you do a breast exam. So for screening per se, we screen almost everyone who has a lump or has swellings. But usually, if you cross an age of 40, then for ladies, we advise that you do a mammograph. Okay. Then, if you are younger than 30, we want you to be familiar with your breasts, with what we call a breast exam. You talk to your physician if there is any changes. Then between 30 and 39, yes, you talk to your physician and we do for you a breast cancer risk assessment. If you have any of the other things that we talk about, the risks. So for us, when you come into hospital, what do? We take you through this assessment. Clinically, we examine your breast, we send you for the mammographs, and then if you have a swelling, we can take off a biopsy and it comes out, and that is when we know that you have. And confidently, with this imaging that we do, we can tell whether you have breast cancer or not, or it is any other breast swelling. So for the treatment per se, if you have breast cancer, it will really depend on the stage that you have. So if the stage 1, you see, will say you can operate. If it's stage 3, stage 4, we give chemo, we can give targeted therapy, and we send you for most of the things to do this. And what I can tell you is that cancer treatment is universal for all of us. So it is universal in Uganda, it is universal in India, it is universal in America. So if you get the right diagnosis timely, you may find that the survival rate is high. And even if you come in late, still you come to us, we examine you, we walk you the process. There are lots of things that we can do about breast cancer. So that is for breast cancer. Allow me to slide into cervical cancer. And right away, cervical cancer, as I told you, now this is for definitely the ladies, unless otherwise. I keep on saying unless otherwise, but it's definitely for the ladies. The ladies have a cervix. I'll show you an image, and it's that part of the cervix that gets the cancer. You know, in the reproductive organs of ladies, they have ovaries, they have tubes, they have a uterus, they have a cervix, and they have a vagina, a sort. Um, so this is what we are in Uganda. In Uganda, cervical cancer ranks as the most frequent cancer among women from 15 to 44. And this is quite a big number, by the way. And it's estimated at about 30% per 100,000 people per year. While the mortality rate is 19.9. Now that is big. And when I tell you that the mortality rate is 19, I don't know how even to layman explain it this, but just know the mortality rate is high. And one of the things that we're going to talk about, we'll talk about and show you why. I already talked about the late presentation. When we present late, we get bad symptoms. The survival rate is low. As I stated there, Uganda is the 7th highest incidence rate of cervical cancer globally and the 2nd highest in East Africa. So we really need to do something about it. So as I told you, a cervix is that part that I described around the uterus, where the vagina will start in layman's language, inside, not from the outside. And it has parts, and scientifically, those are the parts. So I just wanted to show you how it looks like. So sorry if it's a bit disgusting, but this is how a cervix looks like. This is a cervix. So these are vaginal. And this is how it looks like. And this is the opening. Usually when you're in menses, it can open like that. So what are the signs and symptoms of cervical cancer? Yeah, this time we want to talk about it. Yes, cervical cancer can affect a wide range of ages. It doesn't have to be, and that is from the mid-25s and above. So the signs that they present with usually is vaginal bleeding after sex, for us what we call the postcoital bleeding. And then postmenopausal bleeding for ladies that have hit their menopause, and then after some time they start bleeding. So you should be able to check and see whether it points to cervical cancer or something else. Then people who have abnormal discharges. So if you have abnormal discharges, yes, it can be these infections of yours that you get every day, but then it can be cervical cancer. Then pelvic pain on and off, yes, that can also cause that. So I'll say that all these signs and symptoms usually come into ladies at least above the age of 25. And usually ladies that are sexually active, because the causative thing that the causative thing that we really attribute to cervical cancer is the human papilloma virus that is usually got from us men. So whenever you sleep with a man, every man has a bit of an HPV, and that is when you pick it. So, and that is why one of the risk factors, if someone frequently sleeps with different men, they pick up different strains, and in that picking up, they may pick up the HPV strains that are responsible for, for, for cervical cancer. And that is to say those strains are 16 and 18. So for us, usually what we advise is, how do we try to screen for cervical cancer? That is what one would look at. So usually I told you that it's very common in reproductive women of reproductive ages. So these daughters of ours are usually a bit safe till then. So and you see, we use these results of the test to help the practitioners so that we do some regular checkups every 3 years for all women that are aged 25 years and above. So we are going to talk about what we usually do with the screening. So when you see this image, just an image that if one takes an image during screening, you see here looks normal, but this part is not normal. That means that the cervix has started changing. So those are the changes that we actually see. So what are our aims in the cervical cancer screening? As I explained, that usually we screen women between 25 and 64, women on childbearing ages. Okay, and they should not be in menses, and they should not be pregnant, and they should be above at least 21. As I've said, that usually one should have had intercourse of a certain sort and got predisposed to this. But it's not only intercourse that does that. Some people have some genetic issues with cervical cancer. Yes, and some people are immunocompromised. If you have AIDS per se, then probably you have very, very bad kidney issues. So you'll be at a higher risk of cervical cancer than the other population. So we already said that the main causes are usually the HPV 16 and 18, and at least in 70% of cancers, they are identified. So if you ask me who is at risk, so people who usually get STIs alongside HPV and those who have chlamydia alongside HPV, they usually at a higher risk of that. So to top up with this, I just wanted to top up with saying, how do we do that screening? The screening for those ages, usually you come to us, you have heard about things. We can usually do a speculum exam to see some, so because this is taken on a speculum exam. So you take those images and you'll see, you stain, and then you take off a pap smear, then you take it for studying to see whether your cells are abnormal and cancerous or not. So my appeal is that if you have signs and symptoms, you can come for screening in the hospital for that. So that goes for women at least above 25 or 21. When you have those symptoms, then you get that. Then the other thing, that's why you hear visual diagnostics, then you have pap smears. So the other relevant information I wanted us to share is, we give vaccines to try and prevent cervical cancer. So we all might have children, and girl children, not boys, girl children from the age of 8 to 14 years. We usually give vaccines, and the vaccines are against the HPV 16 and 18. So you will find that we have a capping of 14, but it's because we a bit sure that by 14 people have not yet been sexually active. So the other thing is that we can actually give this vaccine to adults, but we can only give those vaccines to adults if we have screened for HPV and you don't have it. So if you don't have it, then we can give you the vaccine. If you already have the HPV, then the vaccine does not give you an extra protection. So as I say, depending on the stage of how you present, we are fond of presenting lately in our communities. And my appeal is for everyone to try, and if they have time, to do screening tests. You don't have to do them every year, but when you have a symptom, please do it. Then continue, get into a habit of doing it at least every 3 years. Because ladies above 25s, we now know that we are at risk. And if you have symptoms, please do that. Then for the breast issues, still please, let's get into an idea, because we have seen early presentation of breast cancer. So as I said, if you present earlier, the survival rate is much more than when you present in stage 3, stage 4, and then the community starts saying that everyone who gets cancer is dead. No, honestly, everyone will die. That is the thing. Everyone will die, but then you can't live a productive life when you actually safeguard your life. Thank you for listening to me. And yes, the treatment of cervical cancer is the same as as the other. We do radiation, we do chemotherapy, we even do surgeries if it's high. So thanks for listening. So we can take in questions now.
Thank you very much, Dr. Brian Bossa. Thank you for the sharing. I guess we have learned a lot, and there are a few questions. There are a few questions that I just want to. They're in the chat. I just want to read some of them. I'm going to read what I can. Then you will answer them. The first is Ruth. Ruth is asking, is that to mean that you can have breast cancer and end up with other issues in the lungs, bones, etc.? That's one. Then Josephine says, last year I went for a mammograph at imaging center. I was disappointed when I was simply given results that my breasts are dense. Hence, the scan was not clear. So how can someone with dense breasts be helped? That's Ruth. The other is Rose, who was asking, how is pap smear done? And then there was also, I think, Joyce, who is where is your location for checkup? So, doctor, you can answer those questions, and then we shall wrap up. Thank you.
Thank you so much, Francis. Ruth, please. Yes, you can end up with issues in lungs, bones, brain, and elsewhere. So this means that when we say that your disease is stage 4, Ruth, it actually means that your disease has gone to the lungs. It will give you lung issues. You're not breathing very well. It will go to the brain. You start convulsing. You go to the bone. You have fractures. So, and when it goes to that site, really, you coming up is the survival rate is low. It's low. So Ruth, that is true. That is why I urge you to do a checkup as high as possible so that we don't get you at that moment. Then Josephine, that is a challenge to every one of us. As I presented, when you have a dense breast, then the pickup of small swellings is very difficult, honestly. But if you do a mammograph and you say, my breast is dense, you know that density continues decreasing every year, Josephine. So my advice would try and do your checkups yearly for that. because even when you can't come and we talk about it, then we do a scan. But if they say dense breast and at least they have seen nothing, that's good to go. At least you have done something. So don't get so disappointed. The explanation, I think, did just come out, but it's the issue. If you combine with the other things, we clinically examine you, we look at the mammograph, then we can tell you better. But at least you're good to go. Thank you for that effort. Don't get disappointed. Then someone is asking that I am actually at Zambia Hospital. I'm a surgeon there. We have an oncology unit. We usually do screening. So I am based there. So how is a pap smear done, Rose? Rose, for us to do a pap smear, that means you have to do a speculum exam. A speculum exam looks at your cervix, then we see the area that looks abnormal, then we just actually pass a slide. You just pick tissues from the slide, then you take it to pathology to read through the microscope. So that is how a pap smear is done. It has a pap smear kit. That is what we use. So it is not an invasive procedure. They're not going to prick you or something. No, please. So it's just a speculum exam, take off a slide, then take it to pathology. Next on the chart.
Yes,
So
there
please,
was Diana, maybe Diana Atwine. I hope it's the permanent secretary or not. Was asking how do you get the courage to be screened, especially waiting for the news. Maybe that will be the last.
okay, then there is a Speciosa who's asking something about myth around HP vaccine. Speciosa, please, vaccine is the way to go. Prevention is the way to go. There can't be lots of things talking about like don't conceive. They're fails. They're not proven. So we are talking from the scientific bit of view of things. So we should actually try to embrace these things. Then, so I'll answer the permanent secretary where we get the courage. And my appeal would be like this. The courage is gotten if you know when you are screened, you have a higher chance of getting a lower stage and you are near to being cured than when you are not screened. So everyone has something in life that is honest. Everyone is going to battle with something. So, but the area that you know it and work upon it, the better. The issue is these things have treatments. And what we're talking about here, breast and cervical cancer, honestly, they have had breakthroughs of this. And they have treatment if you get it at an earlier stage, at all levels. But the results are different. The results at stage 4 are different from a result of stage 1 and stage 2. So the courage should come from us to come and test, knowing that at least our body goes through changes. That's it. You're not going to stay a baby for life. You are growing. Your body is changing. So let's embrace that and try and come for the screening programs. Thank you for that.
Thank you so much, Doctor. Thank you, everyone who has participated. Thank you for that information. I'm very sure everyone has learned something about breast cancer and cervical cancer, and I think generally about cancer. I think we shall share the recording. For those who are not on the WhatsApp group, you could register where I think there was a link for registration. Those who have not registered, maybe you can register so that you're added. But also, Frugencia, our admin, can share the link to join the WhatsApp. But be careful, this WhatsApp, people join in and maybe we don't even know each other. So you be careful to get the right people. So don't just fall into scammers, because sometimes the scammers use such groups to get. But feel free, we shall share the link on the WhatsApp group. And thank you, everyone at Magesta. We are always honored to serve you. And when you join the WhatsApp group, you can actually follow what's taking place in Magesta, knowing our next topic for the next month, and also getting more personal development services with the quotes and sharing about personal development, organizational development, and business development. Otherwise, it's 3 minutes past our lunch, and I do not want to delay people to go and have their lunch, but I want to thank you everyone for joining this Lunch and Learn. It's always on the last Thursday of the month. Yeah, thank you, and hope to see you all next Thursday. And Doctor, thank you very much for the sharing, and I hope people will come to Zambia looking for you because they have learned. Yes, otherwise, have a nice lunch, and God bless you all. Thank you. And people should feel free to leave at leisure.